Hello, I'm Dr. Mini Salunkhe, Head of the Department and Director of Obstetrics and Gynaecology at Mom Story, Hadapsar. Today we'll be talking about the clinical challenges which we face when the placentas are low-lying or they are abnormally stuck to the uterus, which is the Placenta Accreta spectrum. Usually the placentas are organs which are supplying the blood to the fetus through the umbilical cord, and they are attached to the maternal side of the uterus. Initially in the first trimester, we see many of the times in the second trimester that the placentas are low-lying. That means they are attached to the lower part of the uterus or the lower uterine segment near the cervix or the internal os. As the baby and the uterus grows, the placenta, this is not an abnormally adherent placenta, it is a normally adherent placenta. So we call it placental migration, in which the placenta slowly goes up and migrates up into the upper segment when the baby grows and the uterus grows. So initially the placenta, which is low-lying, should usually go up. But there are certain situations in which the placenta remains low-lying. That means it remains in the lower uterine segment, either in the anterior part or the posterior part. This is called placenta previa. So how do we diagnose this? Sometimes the patient may present with painless bleeding, unprovoked or provoked bleeding, maybe because of heavy exertional work, contact or heavy activities. So during the sonography, the placental localization is diagnosed. So when we diagnose a placenta previa, that is a low-lying placenta, we have to see that it migrates up or not. If it doesn't migrate upwards, then these patients usually have to be kept for cesarean section. An adequate amount of blood is, we generate blood in the OT, we keep the blood ready in the OT. And these placentas, why are we so worried about placenta previas or low-lying placentas? Because usually what happens after the baby and the placenta is delivered, the upper segment contracts. So if the placenta is attached to the upper segment, it contracts and the blood is, the hemorrhage is not much. But in case the placenta is at the lower part, the lower uterine segment does not contract so much, and there might be some amount of bleeding, which we have to give some amount of uterotonics or blood products to control it. The other end of the spectrum is that the placenta may be low, it may be in the upper segment, but it is abnormally adherent to the uterine wall. It is abnormally stuck to the uterine wall. And this type of placenta is of three varieties: Placenta Accreta, Increta and Percreta, depending upon how it goes into the uterus, how much it invades the uterus. These placentas have a very different problem, because when the baby is delivered, these placentas just do not come out from the uterine wall. So what do we do in such cases? In such cases, we have to remove as much of the placenta as possible. And then whatever remaining is there, we have to give some injections later on. Sometimes there is so much torrential bleeding that we have to, counsel the patient that she might land up in a hysterectomy, or there might be increased blood loss. But the good thing is that as we do serial sonographies, we understand that this placenta is invading or this placenta is low-lying. And then accordingly, we are all equipped and geared to help such patients who have abnormally adherent placentas. Placenta previa bleeding, as I told you, is usually painless bleeding. Sometimes it occurs. But placenta accreta, the bleeding also may not be there. So if we are not doing serial monitoring and serial sonographies, sometimes the diagnosis may be missed. The only thing what we see is that, the placenta is not going up, it is just stuck to one place. So the good news is that this is a diagnosis of exclusion. We have to be very careful when we are doing the sonographies, and we are always there to help the patient in all cases. Thank you. For more information, please contact us at Mom Story, Hadapsar.